Why are LEEP and cryotherapy treatments for cervical dysplasia? Imagine catching a small warning sign before it turns into something more serious. That's exactly what treatments like LEEP and cryotherapy do for cervical dysplasia. Cervical dysplasia involves abnormal changes in the cells on the surface of the cervix, often caused by persistent infection with high-risk types of human papillomavirus. If these abnormal cells are left untreated, they can develop into cervical cancer over time. That's why early intervention is so important. LEEP, which stands for Loop Electrosurgical Excision Procedure, uses a thin wire heated by electricity to cut out the abnormal tissue. This procedure is usually done in an outpatient clinic under local anesthesia. It's effective for treating moderate to severe dysplasia, known as cervical intraepithelial neoplasia grades 2 and 3. One of the key benefits of LEEP is that it removes the abnormal cells precisely, while sparing as much healthy tissue as possible. Plus, the tissue removed is sent to a lab for examination, helping doctors confirm that all the abnormal cells have been fully removed and guiding any further treatment needed. Cryotherapy involves freezing the abnormal cells with a cold probe. It's generally used for milder cases of dysplasia, like cervical intraepithelial neoplasia grade 1 or some cases of grade 2. It's less invasive than LEEP because it destroys the abnormal tissue without cutting it out. Usually, cryotherapy is performed after a biopsy confirms the diagnosis, and it's especially suitable when the lesion is small and well-defined. The freezing destroys the abnormal cells effectively, reducing the risk of progression to cancer. Both treatments aim to prevent cervical cancer by removing or destroying precancerous cells early on. The choice between LEEP and cryotherapy depends on how severe the dysplasia is, the size and location of the lesion, and the patient's overall health and fertility plans. LEEP is often preferred for higher-grade lesions because it provides tissue for pathology and ensures complete removal. Cryotherapy is a good option for smaller, less severe lesions and is generally quicker and simpler. These treatments are a vital part of early intervention strategies for reproductive cancers. Detecting and treating cervical dysplasia early can significantly lower the chance of developing invasive cervical cancer, which helps protect reproductive health and overall well-being. It's important to remember that every patient's situation is unique, so healthcare providers will tailor treatment plans accordingly. While both procedures are generally safe, they can carry some risks like bleeding, infection, or cervical scarring, but these are usually manageable with proper follow-up care. After treatment, regular Pap smears and HPV testing are essential to monitor for any recurrence of abnormal cells. Always consult with a healthcare professional to understand what's best for your individual health needs.